you also treat pregnant women, or how does that work?
Okay, well, with pregnancy, there are certain points we generally don't use, but we can still use acupuncture. I've treated women in the birth process in states that allow it, because it can make the birth process easier and actually reduce the pain from the contractions without them having to go get either a spinal done or take some of the IV stuff that, of course, can get transferred to the child. So I've treated a lot of women for pregnancy-associated back pain because it's very common. Acupuncture is very good for that, works great. So does prenatal massage. Treated a lot of women for more complicated pregnancy issues like recurrent miscarriages, or treating them for, instead of recurrent miscarriages, it might be somebody who developed gestational diabetes or something along those lines. So you can definitely treat pregnant women. You have to be more careful, of course, just like with regular medicine. You have to be more careful when you're treating pregnant women. But it can be done, and very successfully so.
That's so cool. Thank you for all of your answers.
Oh, you're welcome.
May I ask another question? This is Claudia in Texas.
Sure you can. Go ahead.
Thank you. I also am diabetic, brittle diabetic. So controlling it has been challenged. Is acupuncture good for this?
Yes, probably acupuncture with herbs for that. That's my own personal take on it. Now, there might be people who only do acupuncture who specialize that, and I would not say they're wrong at all. I'm just saying my own personal approach and best success in my practice would be combining herbs and or nutrition with the acupuncture to get the greatest results, because acupuncture is a physical medicine. You know, it works from the outside of the body in. Herbs, nutrition, and things like that are an internal medicine. They work from the inside out. So when you got the two meeting each other in there, you get greater results quicker.
I see. Thank you very much. Thank you.
You're very welcome.
Our lines
Hi there.
are open.
Oh, sorry, Sandy. I have a question. As a kid, I did a lot of cycling, and I was involved in a number of crashes, especially in the velodrome. And I have some really deep sore knots in the top of my neck. And I've had some chiropractic from a good chiropractor, but didn't really help. And I was wondering if acupuncture could help with something like that.
Yes, and I would usually still see the chiropractor, because here's the reason. A lot of the muscles in your shoulder and neck, they attach along the different bodies of the cervical vertebra, and when those muscles aren't working right, they pull those vertebrae out. So it's still important to get them realigned in some way. However, when the pathology or the problem is more of a soft tissue base, knots in the muscles, adhesions, old injuries, scar tissue, then the acupuncture can get in there and break those things down and get the muscles healthier, so that maybe not right away if you're doing okay structure-wise, but then sometime during the course of the care, if the patient's seeing me that way, we'll get them back to their chiropractor and say, okay, now get another series of adjustments, and you'll find that the adjustments not only hold better now, but the patient actually adopts a more correct postural structure in their cervical spine, because the muscles are healthier, the bones are more in alignment, and overall they're just doing a whole lot better.
Wow, very cool. Thanks very much.
You're very welcome.
I have a question. Actually, it's from my husband, Bob, and this is Sandy. He wants to know if acupuncture will help a chronic sinus condition along with allergies.
Yes, it will. Now, how far it will help? Again, so many things with natural medicine have a lot to do with person's environment, the person's health, the person's diet. You know what I'm saying? It's a multifactorial approach. But I've treated a lot of chronic sinusitis, a lot of chronic lifelong allergies, and acupuncture and or herbs and nutrition are very helpful.
Well, that's good. I'm going to have to put them on your schedule. Coming in. Yeah. Okay, our lines are open. Does anybody else have some questions for Dr. Schneindl? Anybody?
Everyone's cold today.
Yeah. Yeah, this is Tim. I'm in Oregon. I'm wondering about your when somebody comes to you and they have their physical problem, ailment, or something. Do you ever get your any guidance from dreams of how to treat the person?
I personally do not. There may be practitioners out there that do. I know there's a field involved in dream analysis. I'm just not that familiar with it.
Yeah, another thing I was wondering about is, what do you think happens when a person's body doesn't work anymore?
Okay, can you be a little more specific? I'm not sure what you're asking there. There's a lot of parts of the body can stop working as well as we age. Our healing decreases in general. I mean, are you talking about what happens on a quantum physics level, what happens on a spiritual level, what happens on a physical medical level? I mean, where would the question that you're asking, which realm are we looking at?
I'm looking at the situation where the body was called dead. What do you think happens? That
is, I'm not schooled in pathology or even the mystic ways of looking at that, so that that's one of those things that I don't have a good answer for. And I know I can tell you from a physical and scientific method what that means, but that's what everyone says it means. So that's about the best answer I can give them. So I don't have the skill set that you're looking for an answer for that one for. I apologize.
Does the acupuncture field see any different dimensions for a being?
Again, there might be some splinter. There's a lot of styles of acupuncture, and I certainly don't know them all. So there may be some out there. Again, I'm not familiar with them or what they might be doing in terms of looking at that. Now, I know I have a degree in theoretical physics, and there are definitely the posits of multi-dimensions within that. And acupuncture has some quantum levels to it, just like neurology does. But in terms of an actual education program that deals with that, or a training program that deals with that in any way, I'm not aware of one. But that doesn't mean it doesn't exist. I'm just not aware of it.
Yeah. I've heard that sometimes with acupuncture, you can open up a person's psychic, whatever you want to call it, self, that they know other people's thoughts and things like that. Have you ever experienced any of that?
I have not personally. Now, I have an intuition when it comes to treating patients when they walk into the door, but in terms of what you're asking, it's a little outside my skill set. There are people out there with that skill set. I'm just not one of them.
Yeah, well, I was just thinking about what...
Yeah, I apologize. The questions you're asking, that's outside my skill and experience. It doesn't mean there aren't good answers for it. I just don't have them.
Do you have
Tim, any others?
main... Yeah,
go ahead, Tim.
I was just wondering, do you have a main purpose or a goal with your life in this acupuncture field?
Well, my purpose has always really been to help people in any way, and that includes my life that I live outside of the clinic, and of course it includes my clinical life. I really get a lot of enjoyment and fulfillment out of helping people, especially people who aren't getting help with more traditional routes. You know, one of the reasons my my practice focuses on pain is it's one of those things that is pervasive and terrible and debilitating, and there aren't very good medical routes for chronic pain and inflammation and conditions like that. And acupuncture, naturopathic medicine, chiropractic, massage, all of these things have some better answers for it to help people live healthier, fuller lives and just really enjoy their life. Even if they still have the problem to some degree, their quality of life improves greatly.
I got a question.
You might be on mute.
Dr. John, this is Bob. Can you hear me?
Yep.
I have a kind of a hypothetical question. What kind of advice would you give to people? You know, there's kind of like an epidemic of drug use, that people take drugs, and they. The rumor is, I don't know that much about it, but the rumor has it that people get addicted on all these different types of drugs because they're in pain, and then they start, they take pain pills, and eventually it leads to a drug addiction. What kind of advice would you have for people like that are on these pain-killing drugs and want to get off of it? What can you do for them?
I would say see a qualified acupuncturist, because state of New Jersey just has that as a qualified opioid addiction, and the state of New Jersey is now a qualifying condition for acupuncture, because the acupuncture can not only treat the pain but help you through the withdrawal process of getting off of those drugs that are potentially destroying your life. And in the long run, they're not helping your pain very much anymore either. If you've been taking them for years, most people will find that now they exist, but their life isn't very full. It isn't very enjoyable, and they still have a fair amount of pain and other health issues because of those long-term use of those medications. And there is a way out. I mean, there's within reason, of course, but I've helped a lot of people within this opioid epidemic that we have countrywide get off of those drugs, do better, and function at a higher level in their daily life, and not need that kind of medication that does really kill the quality of their life by basically, it creates an addiction.
I just came up with a brilliant idea for you, Dr. John, and that's, there's a lot of, like, even right here in Marathon County and probably in the county you're living at, we're next door neighbors county-wise. Well, in our area, employers are having a really, really tough time finding qualified employees. I mean, even McDonald's opens at, you go to McDonald's here in Mosinee, nearby where we live, and there's only one person in McDonald's, and 20 minutes later, when you finally get waited on, and you ask them, well, where's all your help? And they said that nobody showed up, and they're having a real problem. Even when we were over there visiting you yesterday, we stopped by McDonald's, and they didn't even have anybody at the pay window because they were so understaffed, and they can't find people because they can't pass the drug test. And so my thought is,
oh boy, I didn't know that was part of the problem.
Huh? That's part of the problem?
I didn't know that was part of the problem. I know it's right now we're in the economy is doing well in a lot of areas, so much so that there are more jobs than people, and that creates part of the problem. But yeah, there's.
Well, that's a big part of it, that they can't pass the drug test. I mean, even Homeland Security at the airport can't find enough people to check people through the baggage areas for the airlines. They just can't find the help because they can't pass the drug test. They have a lot of willing people, but they can't pass the drug test. And so here's my thought was, maybe if you could set up a program, for acupuncturists to treat people, and you could talk to the employers. You could talk to employers about patients that can't pass the drug test to get hired. You could set up a program with the employer where maybe the employer would hire them under the condition that they were being treated by you or another acupuncturist to get over their drug addiction. How's that sound for an idea?
Well, I mean, I'd have to look a little bit more into it, because I'm sure there's a whole, when you're dealing with that and potential employers, and the trouble with an employer is if they hire somebody who's known to have a drug issue and that person gets hurt or hurts somebody else, now somebody can sue that employer. You know what I mean? It's unfortunately a very litigious society we live in. But I will tell you this, on that same note, one of the best things acupuncture works for is drug addiction in general. They use it in the prisons a lot for heroin addiction and other things. It works great. In fact, it works better for heroin addiction than it does for nicotine addiction, i.e. smoking. It's just for whatever reason, and there's there's a separate ear protocol, and some states used to certify practitioners in the National Acupuncture Detoxification Association's protocol, which is basically for detox or, drug relief, or we sometimes use it even with community trauma like, hurricanes and stuff like that because of the way it affects that part of the nervous system. But there used to be and there is an NADA protocol for treating those people. And I don't know if it's still, I know like Michigan used to have its own separate certification for those practitioners. They weren't really doctors of Oriental medicine and they weren't full-blown acupuncturists, but they were treated how to do that NADA protocol. And I think that some of those people are also working in, like I said, in the prison systems and stuff where there's a lot of addiction. You could definitely get somebody over their addiction prior to employment, but I don't think that anyone who owns a business would open themselves up to that dangerous, Unfortunately, it's a slippery slope, but if you're a business owner and you hire someone and someone gets hurt, then they all look at you. You know what I mean?
Well, I guess there might be different levels of, some, there might be the weekend user or whatever, but for whatever, they can't pass their drug test. I don't know if they're, so heavy into drugs that they're ready to shoot people on a street corner to make a purchase or something, but,
Well, and of course, there are so many different levels of severity.
Yeah, I'm sure there are. Okay, well, let me ask you another question. I see that medical marijuana is trying to make a big comeback. A bunch of states are trying to pass legislation. What's your thinking or advice on people that would be wanting to take medical marijuana? What do you think of that?
I am open to medical marijuana use, especially in an opioid epidemic. In fact, I think there are some of the states that do allow medical marijuana. Opioid and other addictions is another qualifying factor for some of those things, because if you can get somebody off of high doses of oxycodone or hydrocodone or other morphine, other pain-relieving drugs like Dilaudid, and if they're at least in a transitory way using something else that's milder and easier to break, like a medical marijuana, or even if they need it because their brain chemistry's been changed from too long of using the other stuff, there's definitely a place for it. I don't remember how many states allow it now, but medical marijuana is allowed in a lot more of the country now than it is not allowed.
Yeah, it's making a big comeback, I understand. Well, that's very interesting. Well, thank you for your response to that. Anybody else have any questions about this area that I just brought up?
I have a question about the acupuncture, and as an example, if someone has lower back pain and one acupuncturist might put the needles right where that pain is, and another acupuncturist might use the feet or the leg or the ears instead of going to the pain point, why might those two acupuncturists do it differently, and how do both ways work, especially if you're doing it not on the actual pain area? Could you possibly answer that question?
That is a wonderful question. I'll tell you this. With the style I do, most predominantly, the Dung style, I almost never put a needle in somebody's back for low back pain, and I still get them better all the time. You do not have to put a needle where it hurts. Anyone can just put a needle where it hurts. Point to it, put a needle in it. And yeah, that has some good local effect. But now, for instance, Chinese acupuncture has a system that employs a lot of local points. Local points are points where the problem is, but still combines it with some distal points where the problem isn't. That would be more like a traditional Chinese acupuncture. Now, the Dung style is a system that uses almost exclusively distal points and works very well, uses fewer needles, and gets people better quicker for a lot of things. So neither one of those cases is the acupuncturist wrong. They're just practicing different styles. And it's important that the style works for the patient, and it's important that the style is what the practitioner is good at. I've had people come and substitute at my clinic when I'm gone. And I always tell them, treat the patient how you think they need to be treated. Don't just copy my treatment plan, because you won't get as good a result if you're not me, because I do things my way. It's a little bit different. It's primarily Dung style with a little bit of life experience thrown in. Another person coming to sub on my patients might be more of a traditional Chinese acupuncturist. They might be more of a traditional Japanese acupuncturist. And whatever the case may be, they'll get great results if they practice what they know and are good at. Did that answer your question for you?
Yeah. Thank you, doctor. Thank you very much.
You're welcome. Yeah, it's a complicated subject. Sometimes people, and I always tell them, my patients on their first visit, don't be surprised that I don't put a needle where it hurts. Now, there are times that I do, but it's not the primary mode of treatment in Dung style.